Well, so we have to look at mental health, and we have in the studio great conversation maps that we have to undertake.
Yes, and we're with Friends of Mental Health with Jennifer and George Annan. Yes, all right, so Friends of Mental Health. Okay, so let's start with the first question. I know Friends of Mental Health pretty much tells us who you are, but who is Friends of Mental Health?
Well, Friends of Mental Health is an NGO which is focused on two things. One, to raise funds to support the Mental Health Authority to help Ghana's 3 public mental health facilities, and that's Accra Psychiatric, Pantang, and Ankaful in the Central Region. And we also focused on increasing the awareness of mental health and mental illness in our society through advocacy work.
All right. You know, in African cultures, mental health, some people say that, oh no, she's been witchcraft or she's possessed. How have you been receiving, what comments have you been receiving about, you know, mental health?
Well, as you said, like right now, people always think it's a witchcraft thing, or your family has done something against you, or you've gone to cross somebody, or you've abused a substance, or, you know, something. But, I mean, that aside, there's so many different mental illnesses and mental disorders in the system which are actually really common and can affect anybody. Something like stress, something like depression, eating disorders, even the fear of tight spaces. You know, people feel that, oh, it's something strange or it's alien to who I am. It happens to other people, other in quotes, but it can never happen to me. So there's always that feeling of, you know, the outsideness or otherness when it comes to mental health and mental illness. But through the work that we're doing, especially on social media and how you guys having us on board this morning, more and more people are realizing that, no, mental illness is something that it can affect me. And even the CEO of the Mental Health Authority, Dr. Akwesi Osei, says depression can actually affects like 1 in 4 people, and in most of those cases it's women who go through it. So you can see that, yes, it's something that happens to people, and can happen to anybody actually.
And are people coming up and saying, you know what, listen, I think I'm depressed, or I'm suffering from anxiety?
Yeah, we get a lot of messages like that on our social media platforms, Facebook especially. And then they ask questions, I mean, concerning what we're talking about. Like this month, we are looking at eating disorders. And people, the common question is always, can this even happen in Ghana, in the African setting? We love our curvy women. We love to eat. We love enjoying ourselves. So when you're talking about eating disorders, what do you even mean? And then we say, oh, you know, even when some women are pregnant, they eat that substance, or they eat chalk or powder or clay. You know, some people, you know, they do that. It even goes beyond the pregnancy period. Or some kids, when they grow up, they develop a fondness for soap or powder, or you know, strange things which can even affect your body, but they like how it makes them feel. That also falls under eating disorders. People who eat a lot, the binge eating, maybe because they want to get that African figure, so they eat a lot, and then they see their bodies and they feel, you know, unattractive, so then they vomit it out. And then there are other people who are also striving to have the, in quote, Western type of figure, very slender, so they starve themselves or they over exercise. You know, all those different things. People maybe see the signs, but they don't attribute it as a mental illness. So when you talk about it, then they say, oh my goodness, this is actually a thing, and it's actually happening here, and I know somebody going through that. So there's a lot of engagement right now. It's good. People are really getting more involved in it.
All right. So George, let me come to you. So under Friends of Mental Health is Friends Indeed, and what is Friends Indeed about? Okay.
Based on our objective for the year to raise funds to support the mental health facilities in Ghana, the public mental health facilities, we actually did a survey of the public mental health facilities in the country, and we found out that there are some basic items that most of the facilities don't have. One is mattresses. If you are to see the mattresses with the patients, the mentally ill patients sleep on, trust me, you would feel very bad. It's in a very deplorable state. So we took it upon ourselves to at least provide them with that basic need. Also, there's one thing about health facilities: it needs to be cleaned and must be hygienic. It will surprise you to know that most of these public mental health facilities are not even getting the funding from the state, and as such, most of these hygiene products are woefully inadequate as well. So we've taken it upon ourselves as an NGO that's more concerned about mental health to try to provide the public mental health facilities with mattresses and hygiene products for 2018. So that's what the Friends Indeed project is all about.
All right, so basic needs, what do you need? Mattresses?
Yes. And hygiene products.
Hygiene products.
Yes. Yeah. So there we're looking at even detergents, we're looking at bleach, soap, washing powder, buckets, mops, toothbrushes, towels, sanitary towels as well for the female patients who are there. We're just trying to help support them because, you know, it comes up very often that the medical, the staff over there, they go on strike or they threaten to go on strike because, you know, they say they don't have enough items to take care of the patients and they're looking after them out of their own pocket. And in a situation like that, then, and you see the state of the patients and how desperately they need the help, they need the assistance from the medical practitioners. So we said, okay, look, if this is how dire the situation is, this is how we can also help. Yeah. So we're just really entreating the public to either donate cash or in kind to help support the 3 public mental health facilities.
Okay, so we'll get to the details of that, but how long have you been doing this program and how has the support been?
Okay, we started the promotion for this program in April, and the support has been really encouraging. I think the thing is, for a lot of people, they don't realize how desperate the situation is over there. So when you go and you tell them that, look, this is the situation at the hospitals right now. There are patients going through this. There are patients who, when they're admitted, the beds are, you know, threadbare. There are no mattresses. The beds are rickety. Even the mattresses which are there don't have Macintosh. So patients who are incontinent, as in, you know, they have diarrhea or they can't control their bladders, you know, they ease themselves on the mattresses and the medical practitioners then have to wash it. I mean, the situation there is quite desperate. And then, of course, the lack of hygiene products that George mentioned, even cleaning, the gloves and everything that they need to take care of the patients. They are really, it's like they're on a war front, the medical practitioners, and they need all the help they can to help, you know, their patients who are there, who are really some of Ghana's most vulnerable. So when we explain the situation like that, then people say, oh, wow, okay, it's like that. We hear that a lot. It's like, oh, is it that bad? Is it that bad? So when, you know, we put that picture out, then they say, okay, then how can I help? And, you know, the response has really been very encouraging. Okay, so the response has been very encouraging. But with funding, there are always challenges. So what challenges have you guys received? Okay, George. The main challenge is people not being able to ascertain the conditions of the public mental health facilities. It will be difficult for anyone to part ways with his money if he doesn't know the actual problem on the ground. So we are trying as much as possible to create the awareness of the deplorable state of this mental health facilities. And as we go on, people try to accept our message and they are coming on board. So yeah, the challenges are there, but we are trying our best to. So I'm going to take you back to the beginning, Friends of Mental Health. So when someone comes to you, say, like, listen, I'm depressed or I'm suffering from anxiety, eating disorder, what are you guys as an organization doing? Okay, we provide referral services. Okay. So when people come to us and they say, okay, I think I have this problem, we probe a little bit. And then we give the numbers of the clinical psychologists who are also very enthusiastic about the NGO and the work that we are doing. So we refer them, we give the contact numbers of those clinical psychologists to the people who ask for the help. And then we follow up on both ends from those who inquire and from the psychologists to see if that contact has been made. And then, you know, when they say, okay, I've called her or I've called him and they've suggested I do this or that or the other, then I mean we take a step back because we ourselves are not trained psychologists, but we feel that if we're in this position to be middle people, why not be that bridge for somebody to get the help that they need. Okay, Friends Indeed, are you taking any volunteers? Sure, we welcome everyone who is ready to help. Promote the agenda. All right, so give us the details. If I want to donate, how do I donate? Who do I donate to? Okay, you could either donate in kind or in cash. Okay. If you want to donate in cash, we have a short code for MTN, which would be displayed on the screen for people who are ready to donate to see.
We also have a Vodafone short code, which is 710710. And we also have our bank accounts with Zenith Bank, which will be displayed on the screen for your viewers to see.
Let's see if we can get that. Okay, so there's Friends Indeed 2018. So donate a mattress, hygiene products to Accra, Pantang, and Anchor for mental hospitals. All right, so these are the details.
Yes.
And then how long is this going to be running? Is this going to be a forever thing until we have enough products, or we have a time limit to this?
Okay, it's actually a yearly project.
Okay.
And this year we are going to hand over the items formally on June 29th. So we're collecting as many items as we can and collecting as much cash as we can, and we'll donate on June 29th. But of course, if beyond the June 29th date you still want to donate, why not just let us know? We can meet you, pick up the items, or when you send in the cash, you can contact us on 05,000 10,000. Or 0500 13 13 18, and just let us know the donation and where we can meet you with it, and we will hand it over to the requisite authorities.
All right. So apart from Friends Indeed, what are we doing?
Oh, other projects that we have.
Other projects. You see, I'm saying what are we doing because I'm involving myself. Yes. So what are we doing? Yeah.
Okay. So for this year, we have 2 other projects. We have the Stay Sane project, which would focus more on the basic schools and the JHS, the junior high schools. We would go there to try to create an awareness of the prevalence of mental illnesses among young adolescents. And we are doing this in conjunction with the Ghana Education Service and other stakeholders who have shown keen interest in helping creating the awareness. You'd be surprised about the prevalence of the taking of tramadol among youth, and it's a mental illness.
Substance abuse.
Substance abuse is a mental. So we are trying to create that awareness. That's with the Stay Sane. And also have another flagship project that's Setting the Captives at Liberty. This project aims at taking people on the streets, the mental patients on the streets who have been abandoned. We'll take them through rehabilitation and pay for their medication and integrate them back into society.
All right, so quickly, in 30 seconds, Jennifer, your last words.
So I would just like to urge the public to donate as generously as possible and as often as possible, because don't wait for it to happen to you or to someone close to you before you see the importance of supporting mental health care service delivery in the country.
And then George, 30 seconds.
I'll urge everyone who is passionate about mental health to donate generously to this cause, because it serves the good of the nation.
All right. Okay, so you're handing in on the 29th of June. We can find you on Facebook.
Yes, you can.
Friends of Mental Health.
Friends of Mental Health. And on Twitter.
And on Twitter.
Yes, FMH_GH.
Okay.
And on Instagram, Friends of Mental Health.
Friends of Mental Health. All right. So support Friends of Mental Health, so we can hand in mattresses, hygiene products, cash, kind. So you need to support this really, really great initiative. We're going to take a quick breather now. This was Jennifer and George from Friends of Mental Health.